You facilitated this remarkable meeting between between two teams of alumni from the Geneva Learning Foundation's immunization program. You can see up on the screen, I've got a screenshot. It's not that, this is not a message that Valerie just sent. I do want to, by the way, acknowledge Amel El-Tahir and Amadou Yakubu, who shared really interesting comments on Facebook and YouTube respectively. We'll be sharing those with Jean and Michaela. We unfortunately, really just only because of the time constraint, we haven't been able to address those. So, Charlotte, I have 3 questions for you about this sharing of experience that took place on the 25th of September, and then I have 2 questions for Calvin Tonga. Let's start with you, Charlotte. So, this was this meeting took place on the 25th of September. Who responded to the call to share experience about COVID-19 vaccine introduction?
Okay, thank you very much, Reda. And I first of all want to thank the team leaders of the 2 countries, that is Democratic Republic of Congo and Cameroon, for inviting me to facilitate the meeting. So 955 immunization professionals from the 2 countries that are part of the COVID-19 Peer Hub and beyond were registered for this event, and they were able to join with the support of their national EPI authorities.
Okay, wonderful. And so what was actually shared? I believe this meeting was over 2 hours and 20 minutes. What was shared?
Yeah, so the DRC country group wanted to hear the Cameroonian experience of the rollout of COVID-19 vaccines. So the Cameroon country group shared their experience of the COVID-19 vaccine rollout around certain key thematic areas like communication for development, AFI surveillance, data management, amongst others. And the participants from DRC were actually listening attentively and asking questions for clarification around everything that was presented by their Cameroonian peers.
All right. And so what is next for the DRC and Cameroon country teams?
So, like you said earlier, the event that was scheduled for 2 hours took almost 2 hours, 30 minutes, and there were over 50 questions that were asked by colleagues from DRC. And so we are looking at having a second part of this series. That's Saturday, 2nd of October, 2021, during which the DRC country team will also share their experience of the COVID-19 vaccine rollout. And the Cameroonian scholars will be able to provide answers to any pending questions that were left unanswered during the first part of this experience sharing event.
All right. Thank you, Charlotte Mbou, for this summary. Now I'm going to turn to and welcome warmly Calvin Tonga, who's a longtime scholar. He works in the National EPI team, the expanded program for immunization in Cameroon. Welcome. Calvin, how are you doing this afternoon? Thank you for taking time out of a busy national EPI manager schedule. How are you doing?
I'm doing great, Reda. Thank you for receiving me in this program today. It's a pleasure.
All right. Thank you for joining us. Let's see. We have 2 questions for you. First of all, before we even talk about the exchange, you know that the concern is over how quickly the COVID-19 vaccine introduction is going in order to cover the most vulnerable, and then ultimately everyone who needs to be protected from COVID-19. So in the national EPI team, if we ask the national EPI manager, are you satisfied with the rate, the speed at which the COVID-19 vaccine introduction is going?
Obviously, no, Reda. The target that was set by the country is still to be met, and in the field, we've been facing some challenges with vaccine uptake. However, we're really satisfied with the efforts that were made by the government to secure vaccines for the country, the speed at which the vaccines were deployed all over the country, and a strategy was thought to make the vaccine available to all those who were willing to get vaccinated. So no matter the place where you found in the country now, if you need to get vaccinated, you want to get vaccinated against COVID-19, you can find a vaccination center and receive your shots. The big challenge now is demand generation. Many people have, the beginning was very slow. People wanted to understand, and vaccine was introduced in a context that was characterized by rumors and many other adverse messages against vaccine. So that was a challenge for the national immunization program. Immediately we worked on that. We had a crisis communication plan, which is being implemented, and so far we see very interesting progress being made. We see leaders mobilizing their communities to get vaccinated, and we also see the trend in immunization of health personnel that is taking a very interesting shape too.
Thank you, Calvin. And so before I turn to Ian Steed, who has been following these inter-country exchanges, for his question, you have been quite motivated, and so have, I believe, Charlotte said there were 955 immunization professionals from DRC and Cameroon who registered for this inter-country exchange. What is for you the value of sharing with your peers from across the border with the Democratic Republic of Congo, and what do you keep? What do you take away from such an exchange?
Yes, I think it's very important for us to share with our peers because it's an opportunity for us to learn, but also to make a stop and look at what we've done to find out what worked well and what did not. So it's an opportunity for us as a team to assess what we've done and also share our experience, because we think this can help others to improve on their performance or to avoid getting in some trouble we may have faced in the course of the intervention. But for us also, the discussions that we had with the Congolese team gave us some insight on how they perceive the various aspects of the intervention, and also some suggestions. I think that many suggestions were made on how we can get our performances improved, on what could be done concerning the supply chain, the communication aspect of it, so that we improve on the performances that we've recorded so far.
Thank you, Calvin. I want to turn now to Ian Steed. So Ian Steed has been following the inter-country exchanges, and was not able to attend this particular one. So I'm wondering, Ian, what would be your question to Calvin Tonga? What seems like to you like the most important thing to ask and to understand about these inter-country exchanges?
Thank you, Rada, and thank you, Calvin, for being with us today. I appreciate the time. And you've spoken about the value of these exchanges, and I wonder, what would you say to a member of your team, maybe working at a district or a health facility level, who says, "This sounds great, but I don't have the time for this. I've got 1,000,001 things to do as part of my day job." How would you encourage them to take time to speak to their peers, to learn from them?
This is also part of the supportive supervisions that we do, because not only we carry out the supportive supervision, but we train them as supervisors also, even within their health facilities. And one aspect of this is also learning from peers. That is, you have something to give, that is true, but you also have something you can learn from others. From what they do, they surely have tricks and some interesting approaches to the interventions they are carrying out, and you can learn from them for yourself, but also to share with other people. So getting in touch with your collaborators, with your peers is also always something that is interesting, is enriching, and it can also help you share good practices to others in the intervention.
Wonderful. Thank you so much, Ian Steed. Thank you, Calvin Tonga. We're talking here. This is the first Insights Live. So basically, what was supposed to be a 15-20 minute live stream, but we have so much to share. Singular insights by and for the people who make global health is what we are trying to share here. This is something new. We're not, we're still exploring and trying to figure out how to make it work, but we do know that we believe that we do need new kinds of insights as a global community. We recognize the significance of local action to achieve the global goals, but we need fresh insights to support those leading change and a new kind of dialogue